Hi, doctor. This side, the host of today's live session. So today we will be discussing about the topic bronchial asthma, feeling good may not be mean lungs are also cold. So can you please introduce yourself?
Hello, am I audible? Dikti, am I
Please
audible?
introduce yourself, doctor. Please,
Okay.
you are.
Myself, Dr. Okay, thank you. Very good afternoon to everyone. Myself, Dr. Suprova Chakraborty. I did MBBS, DNB Respiratory Medicine, European Diploma in Adult Respiratory Medicine. At present, I am working at Rachi Raj Hospital as a consultant pulmonologist. I have nearly 8 to 9 years of experience in this field. So, present day, we are going to talk about various aspects of bronchial asthma. Thank you. Should we start with questions, Dipti?
Hello,
Yes,
doctor. Am I audible?
yes, you are.
Okay. So starting with today's questions, what is bronchial asthma and how does it affect in a person? Hello.
Your voice is sometimes breaking in between.
Question is, what is bronchial asthma and how does it affect in a person?
Yeah. So, bronchial asthma is basically a chronic inflammatory disease. It's a heterogeneous one. What does it mean? Means there is a chronic inflammation in the lungs, which causes various symptoms like wheeze, chest tightness, chronic cough, and gradually shortness of breath. But the important part of this disease is the variability. ये vary करता है time to time with intensity. More the variation is there, more there is possibility that the disease might be bronchial asthma. So the main symptoms of this disease are chest tightness, भारीपन, छाती में भारीपन लगना, जो काम पहले कर सकते थे उससे कम काम किया जा रहा है, खांसी, जो कि रात को बहुत ज़्यादा हो रही है उस टाइम सांस फूलना, और साय साय करके सीटी जैसे आवाज़ आना छाती के अंदर से, जिसको वी कॉल क्लिनिकली व्हीज। एंड ये हमेशा नहीं रहेगा। द वेरिएबिलिटी इज द की पॉइंट। ये कभी भी मौसम चेंज के साथ बढ़ सकता है, किसी को विंटर में होगा, किसी को गर्मी में, किसी को बारिश के मौसम में। डे टू डे भी सिम्टम वेरिएबल हो सकता है, किसी को रात में ज़्यादा, किसी को अर्ली मॉर्निंग में ज़्यादा। सो दिस इज व्हाट ब्रोंकियल अस्थमा।
Okay. Next question is, what are the main causes of bronchial asthma?
इसका मेन कॉजेज है, इसका कुछ ट्रिगर्स होते हैं। उसमें से आपका एक नंबर है, एक तो एलर्जेन, डिफरेंट टाइप का एलर्जेन, जैसे कि पोलेन हो गया, और भी बहुत सारे हमारे एनवायरनमेंट में ऐसे कुछ चीज़ें होते हैं जो कि एलर्जेन के दौर पर काम करता है किसी के शरीर में। और होता है कि बाहर का डस्ट पार्टिकल्स, माइट्स, फिर पेट में जो फाड़ रहते हैं, घर का जो रेगुलर डस्टिंग में जो डस्ट माइट्स पार्टिकल मिलते हैं वो, एंड ग्रेजुअली इंक्रीजिंग जो एयर पॉल्यूशन है, टोबैको स्मोक है, हर किसी चीज हो सकता है किसी का ब्रोंकियल अस्थमा का ट्रिगर। एंड अगर किसी के फैमिली हिस्ट्री में पहले से ही है तो वो लोग ज्यादा प्रोन होते हैं इसमें।
Doctor, can asthma be triggered by weather change?
सॉरी।
Can asthma be triggered by weather change?
Yeah, definitely it can trigger by weather change because one of the main triggers are dry and cold weather. So when winters are coming, then that is an alarming time. Another time we can see this time when winter is going and summer is coming. Why? Because the sudden temperature change and the humidity change in the air can cause it, because lot of air, when air becomes heavy, it becomes difficult for asthmatic patients to breathe. And another thing is, during temperature change, lot of bacteria, virus and fungus, molds, they grow. So this causes repeated upper respiratory tract infection, lower respiratory tract infection. So these infections cause the triggers for bronchial asthma. So weather change are definitely a trigger for bronchial asthma.
What climate is best for bronchial asthma?
Climate wise, if we talk, bronchial asthma patients can a temperate weather. Temperate weather means where the humidity will be lower side, let's say 30 to 40% of humidity, with the temperature will be moderate, let's say 25-26 degree around. So that is the best weather or climate for asthmatics. So that the dry cold weather would not trigger, nor the humid weather will trigger asthmatics.
Doctor, can asthma patients sleep in AC?
That's a very good and relevant question as summer is coming. Lot of people think about it that we cannot use air condition at all for asthmatics, but that is not so. Here the question again is the setting of the AC. We have to make it temperate. We can switch off the fan, and if we set it in a medium temperature, again let's say 25-26 degree around, then there is no harm using AC for asthmatics. They can use it.
Okay. How is bronchial asthma be diagnosed?
Okay. First of all, whenever a patient comes, we have to take a very detailed clinical history because symptoms are the mainstay of history, which clinically can be diagnosed first. So, patient will say that they have chest tightness, chest heaviness. They are getting, not full breathing. They're not able to breathe fully. They are labored breathing. Someone has to give more effort to breathe normally, or he or she can do less work than they do normally. Then most of the time there are associated symptoms like cough. For some people, cough is more predominant than other symptoms. This cough can be very harassing cough, mainly at night. After too much of coughing, maybe a little bit of sputum comes, the patient may say. And when the cough is too much, then there will be associated shortness of breath, which may be progressive. And there is a very typical timing of this, which is late night and early morning. That is a very like classical timing, you can say, for bronchial asthma patients. Other than that, some people may present, who are having throughout the day the problem of coughing as well as the chest tightness. Some of them having nocturnal wheeze, बोलेंगे कि बहुत खांसी होने के बाद अंदर से साई साई जैसा आवाज आ रहा है, without being using a stethoscope. If a person is standing beside that patient, can hear the noise, that noisy breathing. So that is called wheeze. That is a very typical for bronchial asthma. Then we ask the patient that if anyone in his or her family is suffering from bronchial asthma, because hereditary factor is a major cause. Then any allergic history is present or not, like dust allergy or cockroach, dander, pet at home or not. After taking all these histories, if this is suspect, if there is strong clinical suspicion, then we can confirm the diagnosis by doing a spirometry test. Spirometry is a lung function part of a pulmonary function test. A patient is asked to blow through a mouthpiece. There is a machine, and his actual lung condition being tested. And one normal time we do it, and again 2 puffs of bronchodilator been given, and the test been repeated. So this is how we can confirm the diagnosis.
Doctor, what are the complications of bronchial asthma?
See, if this is not treated, then there are many complications because the patient having acute asthma attacks will have lack of oxygen in his or her body. And if we are not treating this, then they can lead into acute respiratory failure and gradually cardiac arrest as well. And chronically, if we see that it may lead to chronically, oxygen deficiency, sleep apnea, and the chronic inflammation of the lung will, if not controlled, repeated lung infection, pneumonia are the risk factors.
Doctor, at what age bronchial asthma affects and how long does it last?
Sorry, please repeat.
At what age bronchial asthma affects and how long will it last?
See, actually, Uh, initially, it was thought that bronchial asthma would is a disease of young people. But when we see nowadays with the gradually increasing of air pollution and in our lifestyle, we nowadays use various type of chemicals. We have different type of exposure to allergens and uh, different type of chemicals. So this is not there is no fixed rule per se. Bronchial asthma can be seen in very early childhood. There are various, repeated childhood infection which may present later, and when the patient comes with infection, get a follow up, and we can see there is childhood bronchial asthma. It may or may not stay in the adolescence in adult life. Some people come in the middle age or in the early adolescence, and in late stage also, even in the middle age and afterwards also, bronchial asthma can appear. But with the time, if the diagnosis been made very early and not treated properly, then the reversibility part of the disease becomes fixed, means you have a fixed lung damage. So that is the worrisome thing. If the diagnosis being made early and the patient is not treated, then this won't go away, and lung function will deteriorate early.
Okay. What are the necessary medications we can take to control bronchial asthma?
Medications, sorry, the are you
What
asking?
are the
Yeah.
what are the necessary medications we can take to control bronchial asthma?
See, the mainstay is avoid the triggers first. If someone's triggers are identified, let's say having a dust allergy, or you having a pet at home and the fur of the pet is causing that allergy. So first of all, need to try to avoid that allergen to avoid acute asthma attacks or this allergic effect. So next comes we have maintenance medicine and rescue medicine in bronchial asthma. So when someone is in attack, let's say there are vigorous coughing, shortness of breath, and chest tightness, and cannot complete one sentence. So that clinical scenario we call an attack. So that times we need to give some rescue medicines. There are bronchodilators, inhalers, and when that period goes away, the patient thinks they are completely fine. Actually, the inflammation inside lungs still goes. So that is why you need to follow up with a maintenance medication, which are very low dose inhalers, or there are rotacaps. There are various ways to deliver the medicine in the lung, but to ensure that the chronic inflammation of the lung should be under control, so that someone should not have very frequent or severe attacks, which are life threatening actually.
What places and activities should asthma patients avoid?
Okay, so let's say it comes again like what triggers a bronchial asthma patient. So we can see in the winter when it is too cold outside in the early morning and the air density is heavy. So bronchial asthma patient should avoid that. When it is little bit temperate, then they should try going outside. And in case if someone has to go, he or she should follow the precautions like cover your nose, mouth and ear with a scarf or with a muffler. You can cover it. And if necessary, it is necessary to avoid highly crowded and polluted area, and wear a simple surgical mask even protect in long run. As we have seen in COVID, wearing mask reduced acute exacerbation of bronchial asthma in much extent. Some people are having acute attack after doing exercises, so those people will be careful about it, like which actually triggers a attack of asthmatic attack to a person should be avoided, those triggers.
Okay, so doctor, does exercise help in bronchial asthma?
Okay, let's say there is a specific type of asthma called exercise induced asthma. So those patients, while doing exercise only they get the attack. Except those people still can do the exercise, but with the doctor's supervision or monitoring or after the suggestion, they are given some kind of inhalers, bronchodilators just before the exercise they have to take. So that's a separate scenario. But in the long run, if we talk about definitely exercise and yoga, this kind of activities increase our lung function and immunity. But the condition is your baseline disease, that is asthma, should be well controlled. Then only we will be able to do the exercises and all the activities.
Does steam inhalation helps in bronchial asthma?
Steam inhalation is a very popular thing we have been prescribing but using, but it's totally we supportive. We need to understand it what the steam does. Like water content in the nasal mucosa it is increasing. So when someone is having stuffy nose or the nose are blocked, and repeated you have sardi and all, the nasal blockage is quite repeated, and this is associated with bronchial asthma. That time steam inhalation helps to clear the upper airways, that is from nose to your deep to the throat. But per se in bronchial asthma directly as a medicine it doesn't help. It just adjacent therapeutic value it adds to clear your nose and airways, upper airways.
Why asthma can worsen even sitting inside room?
Yeah, because the asthma allergens are, uh, in our bed, there are bed mites. The various bugs are there in every corner of our room. We are not very like aware of. There, it can be cockroach, it can be pet dander, it can be different type of mites. The simple dust that is just on your furniture or on your books, and specifically we should talk about all the chemicals, detergents we are using to day life for cleaning and various purposes, different type of cosmetics and perfumes we have been using. Then room freshener, you can talk about mosquito repellents, incense sticks. So if we look around in our room, there are various allergen can be present around. So even sitting inside room, someone can get the triggers of the asthma. So we need to be careful what we are living with and what is our triggering factor in our immediate environment.
Doctor, does it get worsen with the age?
If not treated, normally our lung function with age declines. So if someone is having bronchial asthma at very early age and that's being not treated adequately, and this is gradually worsens with age, because the in lung function what we see a reversible change in early, it becomes a fixed defect in late stage. and natural lung function also declines. So if left untreated, then it will be declining.
What fruits can be taken?
See, fruits are normally adds a lot of antioxidants, minerals, vitamins in our diet, and bronchial asthma patients can also have fruit. People having some myths that they cannot take citrus fruit, but this is not true because orange, it's a very high, in antioxidant and vitamin C. Bronchial asthma patients definitely can take various kind of fruits, and some people have, more cough while taking ripe banana. That can be avoided. Otherwise, apple, grapes, and pomegranates, oranges, other citrus fruits can be taken easily in the diet and should be added actually.
Doctor, how do you clear airway in asthma?
So, see again the same thing. If in most of the people having allergic rhinitis associated with bronchial asthma, उनका रिपीटेड सर्दी होता है, नाक बंद रहता है, उनमें द स्टीम इनहेलेशन हेल्प्स अ लॉट. अदरवाइज ब्रोंकियल अस्थमा के लिए जो इनहेलर्स दिया जाता है, that is quite sufficient to cleaning the airways, and deep breathing exercises should be done for long term. Like I can show one two techniques, like breathe in, breathe out with your lips first. So the amount of breathe in, like आप जितना सांस ले रहे हो, उससे डबल या 3 गुना आप सांस छोड़ने का कोशिश कीजिए. So that should be the breathing technique. This is deep breathing technique should be advised in stable bronchial asthma patients when they are out of the attack phase, the spasms are gone. So that time, to clear the lower lung portion, one should practice this. Even diaphragmatic breathing is there. We can hold your abdomen or stomach with both of your hands and do the same type of breathing, like exhale more. The amount you are inhaling, you exhale twice or try to exhale twice or 3 times. And in between steam inhalation, then gargling, these are always helpful.
Doctor, is inhaler an addiction or necessity?
See, this is the mainstay of thing. This is another myth that inhaler causes addiction. So let me say, when someone is in trouble, like we have some problem, like we have eye problem, we are prescribed an eye drop. We have a skin problem, skin ointments been prescribed. Similarly, you have an ear problem, some ear drops been given. So when there is a trouble, it becomes a necessity, right? It's no more an addiction. And in a chronic thing, because asthma is a chronic inflammation, and the problem is the variability. Variability means all the time the symptoms are not similar. So the person tends to think that in between they are completely normal, whereas the chronic inflammation inside the lung continues. So what happens, the layer becomes very thick. The mucosa of the bronchi, where the our air goes to alveoli. So these layers becomes very thick because of the mucosa. So what we need, anti-inflammatory drug. So these are the mainstay of bronchial asthma treatment that is given through inhaler device. Why? So that it directly goes to the lung, bypassing all the systems. All the other systems do not require the medicine. So to bypass all these, we are selecting either inhalers or rotacaps to deliver the drug directly. So it is necessary. It's very much necessary to give the mainstay of maintenance medicine. And the maintenance is required or not, you can always go to your doctor for periodic checkup. There are some clinical criteria to check that, and pulmonary function test and other tests being also performed, like phenos, like to see like they can reduce the dose or not. But without doctor supervision, if someone stops, it's like the things are undone. So it is absolutely necessary to follow the proper regimen of the treatment.
What are the side effects of leaving inhaler abruptly without doctor's consultation?
Yes, this is in the consequence of my previous answer. I would like to say, see the bronchial asthma. What it is doing? It is just creating an inflammation in your airway. What does it mean? इसका सिंपल भाषा में इसका मतलब है आपका जो सांस नाली है उसमें म्यूकस ज्यादा भर जाता है, वो मोटा हो जाता है एंड इट कॉजेज स्पैज्म लाइक दिस. तो एयर नहीं जाते हैं, इसके कारण वी हैव लॉट ऑफ कॉम्प्लिकेशंस लाइक एक्यूट अस्थमा अटैक. एंड क्रॉनिकली ये होने से क्या होता है, वी हैव सीवियर लंग इन्फेक्शन ऑल्सो. तो एब्रप्टली जब कोई बंद करते हैं तो उनका इन्फ्लेमेशन अंदर ही अंदर चलता रहता है एंड नेक्स्ट अटैक में बी वेरी सीवियर. वो नेक्स्ट टाइम जब वापस आते हैं डॉक्टर के पास, मे बी he or she will come with an infection with an attack, or itself the attack will be very severe क्योंकि उनको बीच में लगा था they are completely okay, normal, they don't have any symptom, they don't have any difficulty. So that is the tricky part of bronchial asthma, the variability and of the intensity of the symptom. It will make you think that you are a normal person, but अंदर आपका inflammation चल रहा है. तो इसको डिटेक्ट करने के लिए बहुत सारा रास्ता होता है, इसलिए खुद से बंद नहीं करना है, सेल्फ मेडिकेट भी नहीं करना है. यू शुड फॉलो अप विद योर डॉक्टर टू चेक either you can reduce the dose gradually or not, and there are some protocols and guidelines to measure that someone can stop or not. That should be followed. Otherwise you can land up in a very big trouble, like acute bronchial asthma attack with respiratory failure, with cardiac arrest, with pneumonia and many others.
Okay, so moving on to our last question. When and whom should we consult if someone is suffering from bronchial asthma?
Yeah, someone has to detect the early signs of it. Most of the time, for every person, it is different. Most of the people, they may have cough. Some people, they do not have cough at all. They may feel they are just tired or not able to do their regular work. So उनको लगेगा कि पहले हम इतना काम कर लेते थे, अब उतना काम करने से थक जा रहा है. या रिड्यूस्ड एक्सरसाइज टॉलरेंस, लाइक आप एक मंजिल दूसरे मंजिल तक चढ़ लेते थे सीढ़ी, बट अभी नहीं चढ़ सकते. या यंग पीपल में फील लाइक खुल के सिर्फ इतना ही कि खुल के सांस नहीं ले पा रहे. मुझे लग रहा है कि चेस्ट में कुछ दबाव जैसा है, वी कॉल इट अ चेस्ट टाइटनेस, कि लग रहा है कि कोई जैसे चेस्ट को पकड़ के बैठा हुआ है, खुल के सांस नहीं लिया जा रहा है. एंड देयर आर अदर क्लासिकल साइंस लाइक खांसी. आते जाते हैं, कभी भी खांसी हो रहा है तो वो छूटता नहीं है. विद नॉर्मल एंटी एलर्जिक एंड एंटीटूसिव एंड सिम्टोमेटिक मेडिसिन से वो जाता नहीं है. कुछ दिन बाद वो नैगिंग कफ फिर से वापस आ जा रहा है, और मे बी इट रात को वो खांसी ज्यादा दिक्कत देते हैं. रात को बढ़ जाने के बाद मे बी लिटिल बिट स्पूटम में कम आउट. किसी किसी लोगों का स्पूटम ज्यादा भी निकल सकता है, किसी को अर्ली मॉर्निंग ज्यादा होता है. देयर आर सम स्पेसिफिक साइंस दैट, जैसे काम में जाते हैं, वहां पे कुछ डस्ट एक्सपोजर है या केमिकल एक्सपोजर है, तो उसके बाद उनका खांसी होता है. तो ऐसे ही इंडिविजुअल्स हैव अ लॉट ऑफ वेरिएबल सिम्टम्स इन ब्रोंकियल अस्थमा. एंड जब सीवियर हो जाता है तभी सांस फूलने का सिम्टम आता है. तो जो भी अर्ली स्टेज में आपको कुछ महसूस हो रहा हो, प्लीज गेट चेक्ड, प्लीज गेट डायग्नोस्ड कि ये ब्रोंकियल अस्थमा तो नहीं है, or is it something else. So this is important. So whenever one of these symptoms, not necessarily all, and many a times what happens, people suffer from allergy like dust allergy, and they have allergic rhinitis which is not controlled, and it is sometimes they have a chronic gastritis. गैस की समस्या में बहुत सफर करते हैं, उस पे उनका chronic कफ रहता है. Sometimes people have anxiety depression which increases bronchial asthma. जो एंजाइटी एंड डिप्रेशन के बाद उनको छाती के भारीपन लग सकता है. तो ऑल दिस सिम्टम्स शुड बी चेक्ड एंड डायग्नोस्ड कि ये दमा तो नहीं है, should not be overlooked.
Thank you, doctor. It was great hosting the show with you. Thank you.
Thank you so much.